Hi, my name is Naomi Camposano. I will talk about cabozantinib in patients with advanced and progressing hepatocellular carcinoma. Okay, 1 point. Definition. Hepatocellular carcinoma cancer arising from the liver cell. Liver that may be manifested by cirrhosis. Is a primary risk factor for liver cancer. Cirrhosis may be caused by viral hepatitis, primary hepatitis B and C, alcohol, hemochromatosis, certain autoimmune disease of the liver, and other diseases that result in chronic inflammation of the liver. The symptoms include abdominal pain or tenderness, enlarged abdomen, and easy bruising of bleeding. Hepatocellular carcinoma is a cancer that starts in liver that account for most liver cancers. This type of cancer occurs more often in men than women. It's usually diagnosed in people aged 15 or older. Hepatocellular carcinoma is not the same as metastatic liver cancer. Tweets start in another organ and spread to the liver. Okay, application in medicine. Cabozantinib inhibits tyrosine kinase, including vascular endothelial growth factor receptor 1, 2, and 3. MET and XXL, which are implicated to the progression of hepatocellular carcinoma, and the development of resistance to sorafenib, the standard initial treatment for events the same.
In the treatment arm, in the cabozantinib arm. This is very important because now we have two drugs. Both have shown positive data in second line. This is very interesting because we now have potential for multiple strategies and multiple options. It will be very important to understand, of course, the best strategy for each patient. But definitely, we now have plans in place for patients with advanced HCC, even for those who progress after first-line therapy.
The importance of the cabozantinib trial relies on the fact that the three drugs that are in the field so far, that are sorafenib, regorafenib, and lenvatinib, are quite, in lingo of FDA, quite dirty molecules. They are very promiscuous. They are targeting 40 kinases or so. And the cabozantinib, despite that it's targeting several kinases, is more selective. It's blocking BAGF, c-MET, and AXL. So this is relevant in a sense that we know that BAGF is an important pro-angiogenic factor and pro-proliferative in HCC. c-MET signaling is also important. It's activated in 50% of the tumors at advanced stage. And then the fact that with this drug that has a more narrow spectrum of targets is also achieving clinical relevant outcomes, it is important in my mind. The results of the trial were, in summary, that the drug is able to expand survival around 2 months, from 8 months to 10.2 months in second line in patients progressing to sorafenib, without any remarkable adverse events, the usual hypertension, hand-foot skin, and so on, but nothing that is not manageable. And the objective response by RECIST was 4%, with a no bad modified RECIST has not been reported. But I think that it's another additional drug effective that is certainly needed.
Okay, second, pros and cons. The pros is the cabozantinib, it interferes with the growth of cancer cells. So, life expectancy, the treatment with cabozantinib will prolong life longer than under drugs used to treat patients with hepatocellular carcinoma.
The liver is the largest organ inside the body and is located just below the ribs on the right side. The liver has many functions. It filters waste and other harmful materials from the blood. It produces enzymes and bile that help with digestion. And it produces chemicals and hormones necessary for regulating many body functions. Liver cells are called hepatocytes. Liver cancer is classified as either primary, starting in the liver, or secondary, spreading to the liver from cancer in another part of the body. Hepatocellular carcinoma is the most common form of primary liver cancer. It develops in the liver cells and damages other healthy liver cells. Continuous growth of cancerous hepatocytes can cause malignant or cancerous tumors to form. In its early stages, liver cancer does not produce many symptoms and is hard to detect. As the cancer grows, symptoms such as abdominal pain and bloating, weight loss, nausea, vomiting, fatigue, and jaundice or yellowing of the skin and eyes may appear. While doctors do not know exactly what causes liver cancer, chronic liver infections such as viral hepatitis B and C and cirrhosis of the liver can increase a person's risk for developing the disease. Men are more likely to develop liver cancer, as are people over the age of 60. There are different treatment options available depending on the type and stage of the cancer. Surgery or a liver transplant are options only if the tumor is small and contained within the liver. If the tumor is very large or has spread beyond the liver, chemotherapy or radiation may relieve symptoms and prolong life, but this is not a cure.
Okay, this is approach in interferes with the ground, uh, but this is comes comes. For example, serious side effects. This medicine has several side effects, ranging from diarrhea and nausea, or also increase blood pressure and hand foot syndrome. Okay, thing. Applied in Ecuador. Hepatocellular carcinoma is related to a case of cirrhosis or hepatitis B. So this disease is very problematic in Ecuador, taking into account the date according to in and is egg, in egg. Cirrhosis and other life diseases occupy the seventh place of cause of death in the country. Conclusion. In conclusion, treatment with cabozantinib, a tyrosine kinase inhibitor that targets MET receptor and XXI, result in longer overall survival and progression-free survival than placebo in patients with presently treated advanced hepatocellular carcinoma. Adverse events were consistent with the now safety profile of cabozantinib. And the rate of high-grade adverse event in the cabozantinib group was approximately twice that observed in the placebo group.
The trial, as you can see, was positive, as already mentioned, and it showed a median overall survival of 10.2 months for the cabozantinib arm versus 8 months for the placebo arm, which was, as I mentioned, with the p-value of 0.0049 and the hazard ratio close to 0.7, and if anything, this was clinically and statistically significant. In addition to this, the progression-free survival did improve. It bypassed the 5 months for the cabozantinib arm, was only 1.9 months for the placebo arm, and again was clinically and statistically significant. nicely. Also, the response rate was improved. Understandably, TKIs are rather not expected to have major tumor shrinkage, but nonetheless, we had 4% a response based on RECIST 1.1 compared to 0.4% for the placebo arm. And again, this was statistically significant. If we look specifically at the patient who received only sorafenib prior to the therapy, interestingly, the median survival expanded even up to 11.3 months in that specific cohort. The drug was rather very well tolerated. The median dose was ultimately about 36 milligram. And understandably, there were patients with grade 3 and 4, but it was exactly what we expect for that therapy, including the hand-foot syndrome, the hypertension, the fatigue, the anemia, and the elevated AST.